Okay. So Bjorn, you're gonna go ahead and take over?
Yes. All right. So hello and good morning, good afternoon, depending where we are in the country. We want to thank you so much for the opportunity to present this topic, which has either affected somebody we know personally, we have seen in the healthcare field as mental health professionals, as anybody, or just know somebody that's been through it. And that's looking at pregnancy-related anxiety and those prevalence rates during COVID-19, especially here in the US, with our amazing mental health research team here at Albizu in Miami, Florida. We have Monik, Mossini, myself, Bjorn, and Gregorio, and we just saw a lot of this showing up in our field. And I know, Monik, you had a little quick saying about your personal experience with this topic.
So yeah, I just wanted to disclose, I'm a mother of two, and my youngest child was born just a little over a year ago. And I can say that experiencing some of these anxiety symptoms was very real. The concern, and I guess like the biggest issue is just the fear of unknown. Although I might have not like met the criteria for being like a diagnosed with the anxiety, it was something very real, something that my day to day, it was just what's going to happen. What's going to happen when my child is born? Is my husband going to be able to be there with me? He wasn't able to go with me to any of those prenatal visits. So my experience was very, very different. So I do have this background, mental health, and I understand a thing or so about anxiety. So I can only imagine what it's like for the rest of like the population and pregnant individuals. So we're going to talk about more here during our presentation.
Yes. So, well, yeah, what we're trying to say there is that as a general population, we've experienced distress, maybe even death, strained healthcare, and economic instability. We even had a research study that mentioned as soon as you get a COVID-19 diagnosis, I'd say roughly around 14 to 90 days, you might have another mental health concern on the brink. So you could imagine as a general population, but then more specifically to a sensitive, pretty vulnerable population like pregnant individuals. And that's kind of why we chose pregnancy. Why pregnancy? It's a vulnerable period for distress psychologically. That only affects the mother, but also the child or their children. And we already know from pre-pandemic research that anxiety and pregnancy time does come and coincide at times, but when it's elevated, it could also lead to further mental health conditions like postpartum depression. You might even get fetal developmental changes, miscarriages, preterm birth, and even the likelihood that when the child is born or their children, they themselves have their own potential cognitive and behavioral problems to face in the future. So that's what our aim at the studies that we're looking at is to look at those rates of pregnancy-related anxiety within the US during COVID-19 and the secondary wave of effects that poses as a risk for these individuals, right? So our method, we looked at a couple different databases, right? Looking at ProQuest, Psych Journal, PsycBOOKS, ScienceDirect, and we had about 18 articles and we retained 11. We were looking for anything that was specific to anxiety, pregnancy, mental health, COVID-19, stress, and prenatal anxiety. And so while we were looking at all these studies and kind of forming them together, Monique is I'm going to warmly hand this off to her so she can go into more details about what did we find across these studies. Monique.
And I thank you, Bjorn. And I must say that we're not surprised to find that pregnant women, in fact, are experiencing higher rates of anxiety during the pandemic. As you can see in this table, we selected 5 studies for this table. And in the first one here, in the first study, there were 686 participants in it, and 24% of them reporting experiencing anxiety. The second one, we had 788 participants, 44% reporting experiencing those symptoms as well. On the third, 535 pregnant women participated in it, 65% reporting experiencing anxiety. On the third, there were 2,099 pregnant women participating in it, and 43% of them also experienced anxiety. And the last one that we selected for this table, 485 individuals participated in it, and 45% of them were experiencing anxiety. And again, I just want to bring it up that when I mentioned anxiety, this was for moderate to severe anxiety. We didn't even include those who report experiencing mild symptoms, okay? So this is something very worrisome and something that we should continue looking at it. So in total, 4,593 participants were surveyed like in these studies, and from 24.2% to 65 of them reporting experiencing anxiety. So the question comes to what is triggering the anxiety, right? So it's not only just the fear of contracting the virus, but also concerns about the financial stability, their health, the health of the children, limited childcare, issues in the household, and obviously like a loneliness and isolation during the pandemic. Right now, like things have improved a little, but if you all remember in the beginning with the lockdown, I'm sure that's what like the rates was it was like at its highest. And that's about the time when I got pregnant with my second child. So since the onset of the pandemic, we also saw that in-person prenatal visits has significantly declined, with many opting for telehealth services instead. And this is something that wouldn't happen in the past. One of the studies that we reviewed, out of 706 participants, 25.8% reporting stop going to in-person prenatal care visits, and 90% of the participants are reporting change to prenatal care due to the pandemic, including canceled appointments, not being able to bring a support person to those appointments, quality of care, changes in birth plans, childcare arrangements, decreased healthcare access, and obviously reduced psychological counseling services. So what we can see here is not only pregnant women are feeling anxious about being pregnant during this period of COVID-19 pandemic, but they're very anxious about giving birth during the pandemic. What's going to happen to me? What's going to happen to my baby? Right? So in one of the studies that we reviewed, 59.2% of the participants reported feeling worried about the availability of food. 63.7% of them were concerned about losing their jobs and fear the loss of income. 56.3% were anxious about the loss of childcare, and 37.5% reported increased stress related to conflicts between the household members. And what we found is that most of the participants reporting feeling anxious about getting infected with COVID-19, 93% of them. So Bjorn, you're gonna go over the results?
Yes. So to encapsulate all of this, what we're saying is that recent research is showing that pregnancy-related anxiety at the moderate or severe level is high and worrisome, especially during the COVID-19 pandemic and having COVID-specific anxiety, right? So what are those factors? Again, contracting the virus is right at the top, but infecting the fetus, limited access to hospital and healthcare overall, and even that limited contact with family members as we're kind of breaking a little bit and getting out of this bubble, like what am I going to put my child into? There's also a small chance and window that there's evidence of first-time mothers experiencing this anxiety and other mental health symptoms, and that bonding with the newborn could be potentially affected, right? First-time moms, this anxiety is normal. I keep hearing it's normal. So you could imagine that I kind of brush this off, like I should just move on. But when it's to the moderate or severe level, you could imagine the damage it could do to yourself and the child. So wherever we meet these pregnant individuals, whatever clinical setting we might be in, it's really important to assess that degree, that level of anxiety and those adverse effects from the pandemic. So we found a nice list of evidence-based documents like the PROMISE Anxiety Adult short form. It's about 7 questions. The interpersonal support evaluation list, that's to really assess the degree of who is in your social system, who is in your circle that you tend to rely on. And the Godin-Shefford Leisure Time Exercise Questionnaire. And the reason why is because the benefits of having that social support with physical activity at the individual level, they're essential, and that they promote not to stop anxiety, because we can't stop it, that's a world issue, but to really just alleviate it and reduce that impact that the anxiety related symptoms could leave to the mother and the child. And so as we head to the conclusion, something I really want to point out, we're not saying that direct evidence exists between pregnancy and increased COVID transmissions, but that the secondary wave of effects, the psychological distress, that acts as that meaningful discussion for this vulnerable population, right? Pregnant individuals continue to experience these high rates of anxiety during COVID-19. Some of them are pandemic specific, some of them might not be. We have to assess that. And where do we meet this person, right? When we have changing governmental, maybe even state policies, right? Outbreak risks, we have emerging variants. These pregnancy-related anxiety at the research level, we need more longitudinal research that has multiple points to assess them and to see the development and the curve of the symptoms that are specific to this population, right? Expectant mothers can show up in different clinical settings. I'm a mental health professional and my team is as well. We don't see them just in a mental health facility. You can see them in a school, a hospital setting, any setting that a person can show up and be pregnant, you will see them there. So really what we're trying to say is let's meet them in the middle. Sometimes as healthcare professionals, we need to really support pregnancy during this critical time. We might have to educate our patients and our clients. And when things are out of our hands, right, we shouldn't reach into uncharted territory. I'm going to give you that nice warm handoff referral to something or someone that will be able to help soften that long-term effect of anxiety. And I think as professionals, we might be hesitant to let go because we feel like we can take control or take over. But sometimes this is not a single man mission, and we really do need to tap into that integrative setting of working with other people and other healthcare professionals. So having that nice bucket tool belt, if you will, for referrals that you can just quickly be able to show, hey, you're not alone, social support, physical activity, but then here are also additional resources that are specific for you. And that helps soften that blow of pregnancy-related anxiety. I did want to leave some time at the end for any thoughts or comments or questions, but all in all, this was our presentation. We want to thank you so much for your time and attention. Thank you.